Healthy kidneys filter and regulate fluid, waste, and electrolytes. So if the kidneys are not doing this, we are going to see imbalances in fluid, waste, and electrolytes. If the kidneys are not excreting fluid, we need to worry about a fluid volume excess. If the kidneys are not removing waste products, we need to worry about an increase in waste products in the body. If there is a buildup of waste products, we need to worry about changes in neurostatus. And if the kidneys are not filtering electrolytes, we need to worry about imbalances in electrolytes. The electrolytes we need to monitor very closely are calcium, phosphorus, potassium, and sodium. With calcium, we need to worry about brittle bones, muscle issues, and altered mental status. With phosphorus, we need to worry about brittle bones. With potassium, we need to worry about arrhythmias. And with sodium, we need to worry about neurostatus. Healthy kidneys normally make erythropoietin. Erythropoietin is a messenger hormone, and erythropoietin tells the bone marrow to make new red blood cells. So if the kidneys don't make erythropoietin, it can lead to anemia. Healthy kidneys also activate vitamin D, and vitamin D helps to absorb calcium. So if calcium is not absorbed, we need to worry about bone health. We're worried about brittle bones. If the kidneys aren't activating vitamin D, we need to worry about low calcium and brittle bones. Healthy kidneys play a part in balancing the calcium and phosphorus levels in the body, and this starts with activating vitamin D. This is also due because phosphorus is hard for the kidneys to filter out. So if we have sick kidneys, our phosphorus levels tend to be higher, which makes our calcium levels go lower. The reason for this is because calcium and phosphorus have an inverse relationship. When one is high, one will be low. The reason we need calcium and phosphorus to be balanced is for good bone health. So going back to that inverse relationship, if our calcium levels are low, our phosphorus levels will be expected to be high. But if calcium levels are high, the phosphorus levels will be expected to be low. So with our damaged kidneys, phosphorus levels are likely to be high because we said phosphorus was hard to filter out. So for sick kidneys, it's hard to do that. So because of that, with our damaged kidneys, our calcium levels are likely to be low, and that also can be tied back to the vitamin D. Another thing healthy kidneys do is balance pH levels in the body. They do this by producing and holding on to bicarb and excreting acid. If this isn't happening, we need to worry about metabolic acidosis. Healthy kidneys also regulate the blood pressure by releasing renin. What renin does is it vasoconstricts, and renin is released when the blood pressure is low, so it can raise the blood pressure. So renin affects the blood pressure with the renin-angiotensin-aldosterone system. So renin converts angiotensinogen into angiotensin 1. Angiotensin 1 gets converted into angiotensin 2. Angiotensin 2 causes vasoconstriction and the release of aldosterone. Aldosterone holds on to water and sodium. So the goal of this is to increase the preload and maintain the cardiac output. When we talk about renal labs, we're going to be talking about the GFR, the BUN, and the creatinine. So the GFR is the glomerular filtration rate, and this is how fast the kidneys are filtering. The faster, the better. So we want our kidneys to filter at least more than 60 milliliters per minute. Once our GFR drops below 60 milliliters per minute is when we start to worry. Our BUN and our creatinine show the waste products in the body. So we don't want these levels to be high. The higher these levels are, the more waste there is in the body. So for your BUN, your normal ranges are 10 to 20. And for creatinine, your normal levels are 0.6 to 1.2. If there's any renal problems, these are some of the diagnostic studies that we use. First, we have a urinalysis, or a UA, and that looks at the appearance of the urine and the components, so also what is in the urine. For urine-specific gravity, we are measuring the concentration of the urine. So if your urine-specific gravity is high, that means the urine is very concentrated. There is more stuff in it. But if the urine-specific gravity is low, it's very dilute and there is less stuff in the urine. A biopsy will look at the renal tissue. An ultrasound will look at the size, the shape, and the location of the kidneys. A CT will look for any abnormalities or any surrounding fluid. And why are MRIs typically avoided with kidney patients? We like to avoid these if we can because they use dye. And dye is toxic to the kidneys, whether that be IV dye or oral dye. So IV contrast or oral contrast, it's all harmful to the kidneys. So if your patient is experiencing a kidney issue, we don't want to inflict any more injury to the kidneys than is already there. So if we have to use dye on a diagnostic test for a patient with kidney problems, what considerations should we take? We definitely want to increase fluids so we can flush out that dye quickly to try to lessen the damage to the kidneys. And we also want to keep a close eye on our renal labs, so GFR, BUN, and creatinine.